Connie Chan. I am a member of the San Francisco Board of Supervisor, District 1 representing the Richmond. Well, today we're actually telling Kaiser that, to resend back the layoff. They made $18 billion of profits. There's no reason that their CEOs and their executives are getting paid, and yet they're laying off nurses and medical staff.
And you've been here on many picket lines.
Many.
The mental health workers, they've been fined millions of dollars for not having proper, adequate care for mental health. What's going on at Kaiser, since they seem to be oblivious to their requirements to take care of patients?
You would hope a service provider like Kaiser, who providing critical medical and healthcare services to patients, would actually care about patient care. But time and time again, the reason why I'm out here for all the unions, different kinds of picket line, it's because Kaiser, again and again, to actually cut corners to make profits and put profits before patient care. They are now also extending telehealth. You see that they are unfair, negotiation with wages. They are actually even laying off people while they're making profit. All these are tactics for them to actually cut corners and making sure that they can maximize their profits but minimize the patient care. And most importantly, when that happens, that we can see that not only patients suffer, workers suffer too. It's not good for our healthcare system.
Well, where's the oversight? You have the Department of Public Health, you have Ca-OSHA, you have many government agencies. Where are they? The HMO, Department of HMO, the state. Are they doing oversight, and who's responsible for the lack of oversight of what the hospital's doing?
That's right. We can now see California Department of Public Health, Ca-OSHA, we all need to actually step up to the plate to actually see that enforcement is part of the important of this, making sure that this works, the system works. Because even we have laws, be it we ensure patient care, we ensure that all these things that need to follow up the protocol to ensure quality care for our patients and also protection for our workers. It will be nothing without enforcement. We are asking the state government, we're asking Department of Public Health, we're asking Ca-OSHA to step up to the plate to make some enforcement happen.
Well, Ca-OSHA has less than 200 employees, inspectors for 18 million workers. What's going on with the state of California? You think that they're representing the billionaires and not the people?
Well, I think what happened here is that bureaucratic system needs to actually require a reform to really make sure that the system works and then there's efficiencies. I know that some of our progressive state legislatures like Lisa Ortega is up there and fighting to make sure that this works and making sure that Ca-OSHA really continue to have enforcement. We know that we have learned from that the public hearing that was held by member Lisa Ortega that Ca-OSHA has not done in-person site check-in when there's actually failure on sites to protect workers. So we need to actually really make sure that Ca-OSHA break down its bureaucracy and cut the red tape and streamline its investigation system.
And the budget cuts on Medicaid are going to affect 3.5 million patients in California. Why isn't the governor and the Democrats, who have a 2/3 supermajority, calling in a special session and saying that the money that they're going to get from tax cuts, the billionaires, from Trump's budget should go to the people of California? Shouldn't that money be going to the people of California who are losing their jobs?
Absolutely, and if I may be partisan-wise, this is why yes, Prop 50 matters, because we're saying that we need that vote in the Congress and to make sure that when the cuts come, that they will be reversed.
So couldn't California tax the billionaires here and the wealthy? Don't they have a supermajority in the legislature? Couldn't they do it?
Yeah, I think that when you actually impose a tax revenues measure, that it actually has to go to the voter, no matter what.
Well, you could have an oil depletion tax.
It is true. We got to make sure that not only that billionaires need to be held accountable, we also need to make sure that the billionaire companies and actually a company like Kaiser are held accountable. Absolutely.